I want you to imagine a day when you forget people who you love and care about the most. I want you to try and forget who you are, what you look like, where you grew up, etc. Well, someday you may struggle to remember the answers to these questions if they were asked to you. You may struggle to find these answers if you develop Alzheimer's disease. Alzheimer's disease is the sixth leading cause of death in the U.S. Alzheimer's kills more than breast cancer and prostate cancer combined. Currently, more than 47.5 million people worldwide suffer from dementia or Alzheimer's. So you may be wondering, what exactly is Alzheimer's? Alzheimer's is a degenerative disease that targets the brain, which leads to a decline in properly and effectively performing everyday activities. This disease is commonly recognized by a decline in memory, language and its usage, problem solving, and other cognitive skills. Alzheimer's is the most common and most recognized form of dementia, although there are 10 plus types of dementias. If you look at a picture of a normal brain versus a brain with dementia, there are very noticeable differences between the two, and I will show pictures of that in just a little bit. The brain with Alzheimer's looks darker, smaller. You can definitely tell it's deteriorated. This is because the nerve cells in the brain, which control the body and its functions, can no longer function at the level that they should because they've been so damaged. Over time, this disease can affect the brain so much that walking, talking, swallowing, etc. can be very difficult. And Alzheimer's disease is ultimately fatal, but the disease progresses very dramatically from person to person. Here are the pictures that I was telling you about. I think that these pictures really illustrate what dementia does to the brain. Like I said earlier, it appears darker, smaller, really tell that it's deteriorated. In the picture in the left-hand corner, here's the healthy brain, and then the brain with Alzheimer's, and you can just see that the neurons don't look as healthy. The center is not visible. There are plaques and tangles. You may be wondering, am I at risk? I think this is a very valuable question to ask yourself. For some people, Alzheimer's may be unavoidable, but for others, there may be things that we can do to take care of ourselves. The Alzheimer's Association suggests that wearing your seatbelt, fall-proofing your home, and then wearing a helmet when participating in sporting events may decrease your chances of developing Alzheimer's. They also suggest that you avoid head trauma, and I think that we can do a better job at doing that. And then also, if you fall-proof your home like they suggest, maybe you won't hit your head as often, or, they also suggest that you maintain a healthy diet and exercise. This will not only reduce your risk of Alzheimer's, but will also reduce your risk for other health problems. There are several conditions, such as high blood pressure, diabetes, and cholesterol, that also increase your risk of developing Alzheimer's. Like I said before, if you don't use your brain, you will lose it. I think that that's true with many other things, and I think as we get older, we don't exercise our brain as much. We're not going to school, we're not working, we're retired, so it's just not as likely that we're going to use our brain every single day like we truly should be. Some signs and symptoms include memory loss, which is probably the most common one. You may be confused, disorientated. You may suffer when you're trying to solve problems, deal with complex tasks, organizing and planning. You may struggle to find your words. A few other noticeable changes would include personality changes. You may be more anxious. You might start behaving inappropriately, and you honestly just don't know that it's happening. You may be depressed or paranoid, which makes sense because if you don't know where you are, you don't know who you are, you're probably going to be a little scared. There are 4 stages to Alzheimer's. It is the early stage, the middle stage, middle to late, and then the final stage. In the early stage, there are no visible signs, so you won't recognize it, your family won't recognize it. The middle stage is probably when your family would start to recognize it. You'll start to show memory loss. You may struggle at performing daily tasks. You may be moody, depressed. In the middle stage is when the person is unable to recognize common objects and family members. In the final stages of Alzheimer's, the patient cannot speak or walk and probably cannot swallow, control their bowel and bladder. They may experience significant weight loss because they may be forgetting to eat or they just don't want to. They may develop pressure sore, and patients also experience respiratory failure and or pneumonia at this stage. Currently, as a CNA, I know that there are medications out there that can slow your memory loss. It cannot get back what you've already lost, but it can slow down what you're forgetting. Those, of course, come with their own side effects, which kind of the basics. Nausea, loss of appetite, vomiting, increased bowel movements are some of the most common across 5 medications that I researched. Some other side effects include headache, dizziness, confusion, constipation, bruising, and diarrhea. And just like any other medication, it has side effects, and I think you have to find a balance of, are the side effects worse than the disease? And I think in this case, I think the side effects are so minuscule compared to the disease itself. For some other medications, the side effects sound worse than the actual problem. Some doctors will prescribe high doses of vitamin E for cognitive changes of Alzheimer's. So I think vitamin E will preserve your memory function. There's also a stem cell surgery that inserts fetal stem cells through an IV or under your skin. The procedure takes about an hour and has no negative side effects. So I think it could definitely be worth a shot. What does the future of Alzheimer's look like? Economists forecast that the number of people with Alzheimer's will rise to 16 million by 2050. Currently, Alzheimer's costs the U.S. economy approximately $1.1 trillion per year. Currently, $1 billion a year is allocated for Alzheimer's, although $5 billion is spent on cancer and there is $3 billion spent on HIV and AIDS. Currently, every 66 seconds, someone in the U.S. develops Alzheimer's, and it's predicted that by 2050, someone will develop Alzheimer's every 33 seconds, which means that there are going to be people dying more rapidly because of Alzheimer's. Alzheimer's is the only disease among the top 10 causes of death in America that cannot be prevented, cured, or even slowed. And here are some facts that I found were very interesting and also very terrifying. Thank you so much for listening to this presentation. I hope you learned something about this terrible, terrible disease that I'm so passionate about, and I hope that we find a cure or a way to make this disease less detrimental than it is currently.